name is Erin Smith. I'm a nurse practitioner student at Auburn University, and today I'm going to be talking about fibromyalgia. So fibromyalgia is a chronic pain disorder that affects connective tissues by a widespread heightened pain sensitivity. It's characterized by chronic muscle pain, sleep disturbances, and fatigue with normal laboratory and diagnostic studies. It affects 5 to 10 million adults in the United States. It is up to 6 times more prevalent in women than men, especially women between the ages of 20 and 55, and it can affect children and adolescents. The exact etiology is unknown, although it has been determined to be a disorder of the nervous system involving disordered pain regulation, thought to be due to a phenomenon of heightened pain perception called central sensitization, which is an amplification of neural signaling within the central nervous system. There is no definitive diagnosis for fibromyalgia, or not diagnostic test for fibromyalgia. Diagnosis is made based on patient history, physical exam findings of widespread multi-site pain, sleep disturbances, fatigue, and exclusion of other diagnoses or causes. The cardinal manifestations of fibromyalgia is chronic widespread pain at multiple sites over a minimum of 3 months. Fatigue and sleep disturbances are common. Brain fog or fibrofog, anxiety and depression, headaches, whether it be tension migraine or episodic migraines, paresthesias like numbness and tingling and burning sensation in arms and legs. Other symptoms can be chest wall pain, symptoms of IBS or interstitial cystitis, GERD, ANS dysfunction, dry eyes, and Raynaud's phenomenon are also common. So females between the ages of 20 and 55 are at most risk. Genetics can play a role. Studies show that having a first-degree relative increases a patient's chances. Physical stressors such as bacterial or viral illnesses, inflammatory joint diseases are thought to be triggers, as well as emotional stressors and sleep disturbances. So 3 questions to ask during a history is going to be, where do you experience pain and how would you describe the pain? Identifying painful sites is a key component of the diagnosis because patients complain of pain at multiple sites on the upper and lower parts of the body, and a complete pain assessment will help aid in determining severity of disease. You also want to determine how long they've had this pain. For a diagnosis of fibromyalgia, a patient must have experienced pain for a minimum of 3 consecutive months. And then what other signs and symptoms have they experienced, because you want to assess any other signs and symptoms so that you can identify or rule out any other diagnoses. 3 physical exam components. You want to palpate multiple soft tissue and muscular sites to determine how widespread the pain and tenderness is. Again, they should have multiple sites on the upper and lower parts of the body. You want to assess for joint tenderness or swelling. Joints may be tender but should not be red or swollen. There should be no synovitis because it is not an inflammatory disease process. And then you're going to want to assess really any other symptoms that they complain of. Sometimes they have GI symptoms or GU, neurological, some cardiac. So it's really going to depend on what their complaints are and for you to identify or rule out other diagnoses. So treatment, the goal is to improve function, quality of life, and reduce pain symptoms. Non-pharmacologic is going to be stress management, cognitive behavioral therapy and such, low impact cardiovascular exercise. Alternative therapies, you're going to want to improve nutrition, smoking cessation, good sleep hygiene, and a bedtime routine. Pharmacological treatment, initial therapy is low-dose tricyclic antidepressants, particularly amitriptyline at night. An alternative to amitriptyline is cyclobenzaprine. For patients with severe fatigue and depression, SNRIs are given. Duloxetine and milnacipran are recommended and FDA approved for the treatment of fibromyalgia, as well as Lyrica and gabapentin for patients with severe sleep disturbances. You always want to start at the lowest dose tolerated and only start 1 medication at a time. NSAIDs are not recommended because it's not an inflammatory process. And opioids are also not recommended for anything other than a short course for a flare because they're proven to cause worsening of pain actually. So patient education is going to be to educate the patient and the family that fibromyalgia is a real illness, but it is not degenerative or life-threatening. You want them to understand that there is no cure, that treatment is managing of symptoms of chronic pain and fatigue, which can be very difficult. And you want to help the patient set realistic expectations. You're also going to want to educate on lifestyle changes, diet and exercise to improve quality of life and reduce symptoms, and then educate on medication use. And especially the NSAIDs and opioids are not often that effective, and that opioids can cause harmful side effects. So thank you so much.